Hi, my name's Áine Lyng, and I'm a Senior Cancer Prevention Officer with the HSE's National Cancer Control Programme. Today, in this rapid fire presentation, I'm going to talk about some of the national cancer risk reduction initiatives that we run. The initiatives that I'm going to tell you about, they're inclusive. We try and make sure that anything that we do supports health and social care professionals in the work that they do with various different populations. One of the first things that I do want to acknowledge is every person's risk of getting cancer is influenced by a wide range of factors. There's things we can't change, such as our age and our genetics, and there's things that we can change, such as our alcohol intake, our vaccination uptake, our physical activity, or protecting skin from the sun. We know that about 30 to 50% of cancers can be prevented. It means there is a whole host of cancers that we can't prevent, but we do know that, look, we can all take steps to reduce our risk of cancer. Today, I'm going to talk to you about 3 different initiatives that we run that might support you in your work. I'm going to talk about evidence and research that we do, education programs that we run, and resources and support that's available to you. First of all, if I talk about the evidence and research that we do. Now, Kieran's already presented to you on the National Cancer Awareness and Attitude Survey with the general population, and hopefully that information will support you in the work that you do and inform any initiatives. Before that survey, we actually conducted a national survey on lung cancer awareness in 2020. This survey itself, it was conducted with adults over the age of 50 living in Ireland. The reason it was adults over the age of 50 is this population are more likely to be diagnosed with a lung cancer rather than a younger population. The survey itself, there were 750 telephone interviews conducted nationally, and then 250 face-to-face interviews conducted in Carlow and in inner city Dublin. The reason these interviews are conducted face-to-face in those 2 localities was due to the prevalence of risk factors and the proportion of late-stage diagnosis of lung cancer in these areas. So as one interesting stat that did come from that survey was that 90% of those interviewed were aware of smoking as a risk factor for lung cancer, but only 1% were aware of radon as a risk factor for lung cancer. If you are running any initiatives in relation to reducing risk of lung cancer or early diagnosis of lung cancer, I would encourage you to look at that survey and the information within it. We are about to take national cancer awareness research with social inclusion groups. We're starting with the traveller community, and we hope to spread this research into other social inclusion groups as time progresses. The research with the traveller community, the project plan has commenced this year, and we'd hope to publish results next year. Again, we'd hope that this information and this data can inform you with regards to initiatives that you're going to run with the groups that you work with. We also run some education programs. And again, the purpose of these education programs, it's to support you, health and social care professionals, to understand what are the modifiable cancer risk reduction behaviours and what supports are available for the populations that you engage with. We're in the process of publishing our short course e-learning modules. These modules are on HSE land. They're about modifiable cancer risk reduction behaviours, and they're for health and social care professionals. Each module, it explains how a risk factor affects cancer risk, which cancers that this risk factor is related to, and it signposts to support further information for yourself and for the population that you work with. The modules themselves, they take about 10 to 15 minutes in length. We have 11 modules in total, and today we're actually launching 3 of these. So it's reducing cancer risk in alcohol, reducing cancer risk in tobacco, and reducing cancer risk in skin protection. If you log on to www.hseland.ie and type into the search bar these modules' names, you'll be able to find them. We will be publishing more modules across 2023, and the topics that we'll be publishing modules on are body weight, eating for health, physical activity, radon, screening, HRT, breastfeeding, vaccines, and workplace carcinogens. And the idea of these modules is trying to support you and educate you about what are the modifiable cancer risk reduction behaviours and where you can access more support for your populations that you work with. And finally, if I signpost you to the resources and support that are available, you can see on the screen there some images of resources that we have developed. All of our resources are housed on www.hse.ie/cancer prevention. We've got videos, we've got posters, we've got leaflets, we've got fact sheets. If you go onto our webpage, you'll be able to see what might work for you and the work that you do. You can also visit healthpromotion.ie. On healthpromotion.ie, you can choose the cancer drop-down, And you'll see a number of our resources there that you can order for prints. And finally, if you contact prevention@cancercontrol.ie, you could submit a request for a resource, or if you've got any questions, we'll get back to you with some advice. I said at the beginning, not every cancer is preventable. So early diagnosis is important. It's so important that if anybody notices a sign or symptom of cancer, that they act early and they contact their GP. To support you in your work, engaging with various different populations, we also have a number of resources and education available to you. If you visit our webpage, www.hse.ie/cancer early detection, you'll see all of our resources there, including past webinars. Again, if you go to healthpromotion.ie, choose the cancer dropdown, you'll be able to order some of our resources to print. With the early diagnosis resources, you can see that they're graphic heavy, and we're trying to make them as easy read as possible. And finally, we also have some education on HSE land. If you go to hseland.ie and type in early diagnosis of cancer, you'll be able to access the e-learning module there. Finally, the call to action. I've outlined some of the initiatives that we're currently running and some that are coming down the line. If you sign up to the Irish Cancer Prevention Network newsletter by contacting prevention@cancercontrol.ie, you will receive our quarterly newsletter, which will provide updates on various different initiatives that are running at various different times of the year. I wish you all the best in your own work, and thank you for your time.